Dementia has been described as the storm on the horizon that will affect the whole world. As populations age rapidly, how prepared are governments to handle a flood of patients who can't look after themselves? Hello and welcome to Roundtable. I'm Enda Brady. Now, Europe is going grey. A third of its population will be over 65 by 2060, and a sizable proportion is expected to develop dementia. The progressive condition kills more people than breast and prostate cancer combined. So, does Europe have enough caregivers, geriatric specialists, and funds to cope?
This is Leonor Camacho, a 90-year-old with Alzheimer's, retracing the steps of her past. For people with dementia, music can be one way of filling in the blanks in their mind.
It makes me very sad because I remember my husband. I listen to the music with joy because it brings back many memories that make me happy.
But ultimately, it cannot reverse what this degenerative condition strips away: your memory, reasoning, character, and motor skills. In its end stages, patients are utterly dependent on others to clothe, toilet, and feed them. An estimated 55 million people worldwide have dementia. That number's expected to triple to over 150 million by 2050, hitting developing and low-income nations the hardest. In Europe, around 10 million currently live with dementia, but that number's expected to double by 2030. Governments around the world are unprepared for this epidemic, for which there is currently no cure. According to the World Health Organization, it already costs the European economy $300 billion per year. That's more than the entire gross domestic product of Finland. But health systems everywhere, as they're set up now, just won't be able to cope as their populations age fast.
We know that the number of people with dementia are increasing globally. Dementia not only is devastating for the person with the illness, but also for families and caregivers. And they also cause substantial costs to society in terms of economic costs.
The irreversible disease takes its toll on families who often step in to do unpaid caregiving work. And it's an emotional rollercoaster ride, watching a loved one become a stranger to you. Several drugs such as lecanemab and donanemab have come on the market recently, but they're known to be effective only in the early stages of dementia, and they're prohibitively expensive.
Because the disease is incurable at this stage, what we can do is just to defer the deterioration of the disease.
Of course, there are lifestyle adaptations you can make, such as quitting smoking, increasing the amount of exercise you do, and eating healthily. Such changes are thought to cut the risk of developing the condition almost by half. Social activities and getting a full night's sleep help too. But until awareness about the condition increases, health systems improve, and effective cure is found, for seniors such as Leonor, the music of the mariachi band is merely helping slow the progress of the disease.
Let's meet our guests. Joining us from Cardiff in Wales is Professor Julie Williams. She's director of the Dementia Research Institute at Cardiff University, and she's also the former chief scientific advisor to the Welsh Government. In Limerick in Ireland is Dr. Mary Ryan, a consultant endocrinologist and senior lecturer at the University of Limerick Bon Secours Hospital. Roy Lilley is former chairman of a National Health Service Trust in the UK and currently a health policy analyst and commentator. He joins us from London. And I'm delighted to say here with me in the studio is Bart De Strooper, a world-renowned Alzheimer's disease researcher. He's a professor in dementia research at University College London. You're all very welcome to Roundtable. Bart, I'll come to you first. Dementia and how we treat it going forward. This is a conversation we all need to be having.
I think it's super urgent. There is an enormous wave coming up with increasing life expectancy. So we expect that the number of people with dementia will be triple the number that we have at the moment in 2050. So it's really very important that we talk about. And it's also important because there is a lot of breakthroughs in this field. At the moment, we are making progress. So it's really important to get the dynamic around this.
7,000 people a month diagnosed across the UK. These numbers are staggering.
It is one of the most important medical problems, especially in the Western countries, but we shouldn't forget that also developing countries see an increase in life expectancy and a rapid increase in the numbers. In fact, the largest increases are expected in South Asia and in South America in numbers. But the numbers of patients with dementia is already slightly larger than the number of people with cancer in the world. And of course, if we triplicate, it will become even much bigger.
Julie, I'll come to you. I mean, dementia is something that we generally don't talk enough about. It happens when a friend's parent or grandparent gets it, but this really is an urgent topic of conversation now.
It is, and I think most people will know somebody who has dementia. And as Bart mentioned, this is going to increase dramatically over the next few decades. Where we are, I think we are making progress. We are finding new potential targets for therapies. So I think there's optimism that we may have treatments that may help prevent or delay the onset of dementias in the next 10 to 20 years. But it needs resourcing, it needs a lot of activity. And although that has increased over the last few years, there's a lot left to do.
Mary, how important is an early diagnosis when it comes to dementia?
Well, I think it's very, very important. As you said there at the outset, 1 in 11 over 65 have dementia. It's going to affect 1.4 million, they're saying, in 2040, and then 1.6 million in 2050. So when we're talking about dementia, we can divide it into Alzheimer's dementia and vascular dementia, and particularly with vascular dementia, which is where we've plaque on the arteries that's blocking oxygenated blood flow to the brain and causing brain atrophy. And it's one of the most common forms of dementia over the age of 65. We can do an awful lot with early intervention, but early intervention means treating the high cholesterol in the 40s, not in the 70s, treating the high blood pressure. So all of those things that cause that plaque in those arteries, that is reducing the oxygenated blood to the brain. So keeping the blood pressure normal, treating the high cholesterol that's very high, keeping the blood sugar right. Diabetes poorly controlled will cause a lot of plaque, particularly because of that very aggressive small dense LDL cholesterol. Obesity, we have an epidemic of obesity at the moment. We really need to get on top of the abdominal obesity, because we know that the fat cells here make inflammatory markers that really damage the lining of those cells and cause plaque. So we need to really get the overweight and obesity on target and do this at an early stage, and of course smoking as well. So I think it's about educating the public, saying dementia is the biggest killer now in the UK and Ireland, and that we really need to be as aggressive as we were with the COVID pandemic vaccinations and as aggressive as we are with heart disease. But in actual fact, dementia is our biggest killer. And as the other people have said there, that it's, we are an aging population. Thank God we're living longer. We want to be healthy. And with those figures that we said at the outset, where dementia, 1 in 11 over the age of 65 get it. But even with regard to Alzheimer's, early diagnosis, as some of our experts have said there, is so important with the new treatments that are available. So I think we need to expedite the funding, the research, because this is a big killer. We are all going to live longer, and therefore we need to bring the research on board, have the funding to do so, educate the public about, early intervention with regard to vascular dementia. But even if they notice any of the signs, that they would come along to their GP and that they would be able to access the medication that's been shown to be proven to help Alzheimer's. So I think that's really what we need to do in our whole public programme.
Roy, I was very shocked to learn that dementia is killing more people in the UK every year than any cancer. I mean, this is something we all need to start talking about.
We do. And we sort of went through a period before COVID where we did speak about it. When David Cameron was the Prime Minister of the United Kingdom, he had a dementia awareness campaign. He had an expert in to train members of the cabinet about dementia awareness. We had some shops that had supermarket checkouts where people with dementia could go shopping, and there was an awareness. COVID, of course, then came along, and all of that was just forgotten about. I mean, the NHS is in no way really prepared for this, and Bart's estimation that it's going to triple. I mean, it's just a heart attack for the NHS. I mean, the difficulty we've got is there are very few interventions. You can go to the GP, you can get an early diagnosis, you may be put on a regime of drugs, maybe Aricept or something like that. And then there's another drug, I think, donanemab, which Eli Lilly have got in development now, but it hasn't been approved. It's been approved for use in the US, I think, but not here. And it just takes forever for these drugs to get approved for all the safety reasons. So what happens? Well, the NHS really can't do anything. All it can do is to point the families in the direction of social care, social services, and frankly, they can't manage with ordinary discharge from hospital, never mind people with dementia. I mean, it's a specialist skill to look after people with dementia. People with late stage dementia can become aggressive, they can become violent, they can wander, they can become incontinent. The families just can't manage it. So social care has to look after it. Often the cost of that falls on the families. And then, when it falls on the family, you're looking at, maybe £2,000 a week. That's £100,000 a year. That usually comes out of the proceeds of the sale of their dwellings. And after that, it falls on the state. It is a totally unprepared, completely useless response to something that's going to get a hell of a lot worse before it gets better.
Thanks, Roy. Well, just on the issue of the impact on families, last year the legendary Manchester United and Scotland footballer Gordon McQueen passed away after years fighting dementia. His daughter Hayley McQueen explained to us the impact it had on her family.
Dementia, unfortunately, is something that I have witnessed firsthand with the decline of my dad being diagnosed in his 60s and passing away just last year at the age of 70-year-old. And actually, it's so cruel. People describe it as one of the cruelest diseases, and we had thought it was going to be mainly a mental struggle, but for him actually it was worse because it was more physical. He'd been a professional footballer, and to see him going from fit and healthy and strapping to literally lying in a bed for months on end because he couldn't put one foot in front of the other and he got confused, his balance was all off. There are so many little things about dementia that you just don't realise. He had dysphagia where you couldn't swallow food and lost weight at such a rapid rate. It was horrible to see. And to see him know that he had dementia. He knew everyone around him. He knew all his family and friends. He might not have known what year it was, what day it was. But I think one of the cruelest things is if you're aware of your illness, your disease, and he was. But surround yourself with as many people as you can, because it literally took a village to look after my dad. We had people popping in to my mum's every day, a few times a day, as well as carers and my mum. We had friends, and that's what kept him going right up until the end.
And Bart, that experience will be repeated in thousands of households from the United Kingdom to your country, Belgium, all across Europe, all across the world.
What I would like to say as a scientist is that we should push further on the track we are and get medications. Because care, it's necessary, but we will not be able to cope it. A point I would like to make there is that we hope sometimes that we can bring in people from the developing countries, but that's just not the solution, because these people will be confronted with the same needs. So we need to find a solution in our laboratories, medication, to help the patients. And that's, for me, the most hope-giving thing at this moment, that we see the first breakthroughs. So donanemab is one of the drugs. There is also aducanumab and lecanemab. So there are 3 antibodies which have been approved in China, in USA, in Japan, in Australia. Europe has rejected it because fear of side effects, and because it's not too expensive, I must say, but fear of side effects. Typical European reaction to look to the half-empty glass. Me as a scientist, I look to the half full glass. I say, this is the first medication. Think about what happened when AIDS came. I was a young doctor in Paris. It was the sida. Nobody knew what to do. Everybody was afraid. The first medication was pills, 4 a day, for a lot of side effects, little gain. But that was the beginning of a success story. And we are now, since this year, in the same type of success story. But European government, I cannot speak too much about the UK government because I don't know what they are going to decide. It's their opportunity to show that the Brexit was useful. But Europe, it's a big disappointment that they didn't get that drug approved and giving the chance to patients and doctors to test it. But so, summarizing, I think we are in a great time. There is a lot changing. I expect that we will see more of these drugs. There are also for ALS and other neurodegenerative disorders breakthrough. So it's really an exciting time. After 30 years being in this field, I see finally that there is some light at the end of the tunnel.
Progress.
And I think this message needs to go to society, to the patients, to the politicians in the first place, because they need to think about strategies on the long term. So care and cure needs to be both tackled, and there needs to be a discussion about it. So it needs to go out of this taboo which has been hanging over dementia and neurodegeneration all these years.
Julie, I see there's a blood test now. This is a big development in the last couple of years, a blood test that will indicate the likelihood of a person developing dementia.
Well, I think what you're talking about is, comes from the genetics, but there are also blood tests that can add to this. Our work, we now with very large international collaborations have identified over 100 genes for Alzheimer's disease. And what is frustrating as a scientist is that we have so many new leads that we can follow for potential treatments. I think Alzheimer's and other dementias are going to be like heart disease, where you have a number of things that you can take to prevent or delay the disease, cholesterol, blood pressure, all of those elements. And I think common form of Alzheimer's is very similar. A component we've already addressed with what Bart has talked about with these new antibodies, but there are more complexities to these diseases. And what is somewhat frustrating is that we have leads. For example, we know that several aspects of the immune system are affecting your risk of developing Alzheimer's disease, and we have lots of lines for further study that we know some of those will result in targets for treatments, be they drug targets or in some cases genetic therapies. So it's up to a time for optimism in terms of what we know. We just need to have more resources to do all of these experiments so that we can nail down these new treatments. Now, you mentioned a test. We have a genetic test that will tell you if you are going to get Alzheimer's disease or not with about 80% accuracy. Now, that is only useful when we have treatments that we can give people that have that risk. So I hope that in time we will be able to use these tests and blood tests that are also being developed alongside to identify people before they develop any of the neurodegeneration, which is where you want to treat people to prevent any damage in the future. So there's optimism, but we need a bit more resource to follow up all these leads.
Mary, you mentioned earlier on some of the factors we could look at in terms of staving off dementia. Dr. Mark Milstein is the author of The Age-Proof Brain, and he has 7 what he calls hard rules for boosting memory and fighting off dementia. Number 1, keep your blood pressure and cholesterol levels in check. 2, managing sugar levels. 3, getting quality sleep. 4, eating a nutritious diet. 5, not smoking. 6, making social connections. And 7, continuously learning new skills. I mean, there's a lot to take on board there, but those are his 7 golden rules.
Totally, and they've been backed up by Professor Roseanne Kenny here with us here in Ireland. So yeah, they're the golden rules, and certainly we have to strive as a nation, but also as physicians, to make sure that we use those. And a lot of those are so simple, like educating people about proper sleep, eating healthily, taking exercise, and also keeping all the parameters that I spoke about and that you've just listed, keeping them normal. And I think that we have to focus on that as well as on treatment. So there's a lot that the public can do by making sure that their cholesterol, their blood pressure, they're eating healthily, they're exercising, and that they're doing everything to help their brain health. Even brain exercises are fabulous. Meditation, breath work, all of this has been shown to help with the whole immune system and help with our brain health. And in addition then, we also obviously have the treatments that can come on with patients' Alzheimer's. But I think in particular, we have a duty to do as much as we can with prevention. And I don't think that we're doing enough. We certainly, as I said earlier, we're doing it with heart disease and with an emphasis now on obesity. But we need to bring all that together and say that we can also improve our brain health by really targeting these. And I think the public then can get involved and know that they're helping their brain health and reducing the amount that get vascular dementia, because remember, it's costing 42 billion a year to treat dementia in the UK. So if we can get the public on board at a very young age to, go to their GP and make sure that they have all the risk factors kept at a normal target, then it's going to prevent a lot of vascular dementia, and then allow those patients that need treatment to access it quicker. And hypoxia, which is low oxygen, has been shown to be a factor as well in Alzheimer's. So by targeting all the lists that I've spoken about and that you've just listed there from that book, that definitely will help. And the Tilda study has shown that. So we do need, as physicians and in the public and politicians, to target, to educate the public to really help themselves to improve their overall brain health, and also help the health of the nation in doing so, because it will allow those people that need treatments to get more attention and treatment.
Roy, we're all living longer. How much of a ticking time bomb then is this for the National Health Service in the United Kingdom?
It's huge. I mean, these drugs that are being developed now, they're going to come onto the market. They cost a huge amount of money to develop. They're going to cost a huge amount of money to prescribe. You can kind of see it coming. The politics of this is really very important. We've got a new government in the United Kingdom now. It's a socialist Labour government. They came in and said they were going to fix the NHS, but they also came in and said that they're not going to put up taxes and they're not going to charge us any more for anything else, with our taxes and our income and everything else. So where they're going to get the money from to improve the NHS, I don't know. We've got a budget coming in October, so maybe we'll know more then. But it is pretty clear that this is a huge problem that's coming down the track. And the annoying thing is that you can see it coming down the track. We know what the costs of it are, and the costs of it vastly outweigh the cost of the research and the development that it would be to get something that actually works. I mean, at the moment, we're kind of fiddling at the margins of our knowledge. We need a whole national imperative. I mean, we've left the European Union, which, depending on what your views are, it was either a good idea or a sort of huge national act of suicide. But either way, the combined resources of the United Kingdom and Europe, it seems to me, with any number of very big pharmaceutical companies based here, there ought to be a way that governments can come together and make this an international effort, and we can accelerate the development of these drugs in very much the same way that we accelerated the development of vaccinations for COVID. I mean, I think the UK managed to produce the first Moderna vaccine. I think that was, or perhaps it was AstraZeneca. Yes, I think it was AstraZeneca's vaccine. That was done in something like 12 weeks. I mean, it was a huge accelerated program. I think it's probably not possible with these drugs to accelerate them quite that much, but I'm sure we could cut years out of the development because it does take years. And as it stands, the answer to this is not more care homes because it will cost a fortune. It's not more people because it will cost a fortune. It's better pharmaceutical solutions, which will cost a lot of money, but in the end, it will save us a fortune.
Bart, I want your opinion on diagnosis rates. So just have a look at these stats from the NHS England. So low diagnosis rates of dementia in Black and minority ethnic people. 3.8% of Asian and Asian British patients diagnosed in June 2024. 1.6% Black African, Caribbean or Black British people. And this compares to 70% of eligible white people. So what's going on there? Is it a cultural thing, or what's with the diagnosis difference? Because that's huge.
If you are in the rich part of the population, your healthcare is in general much better than if you are in the poor part. And you see that with heart, with cancer, with simple things like hearing treatments or even visible system. The overall health is much better in
so
this
socioeconomic.
So it's for me mainly a socioeconomic problem and not so much a cultural thing.
Julie, Mary, Roy and Bart here with me in the studio. Thank you all so much for your expertise. Remember, you can see more discussion and debate on our YouTube channel. Just search for Roundtable TRT World. And if you like what you see there, please do hit that subscribe button. But for now, from me, Enda Brady, and all of the team here, goodbye and thank you for watching.